The news day continues here on One News Now. I'm Charles Lejano. It's All Souls Day, but the living have no choice but to show up for work today, after November 2 was declared a special working day. So to tell us the latest traffic situation on the ground, we now have Mon Gualvez reporting to us live from Commonwealth in Quezon City. So Mon, good morning. Does it feel like All Souls Day out there?
Charles, after the long weekend, it's now back to work for most Filipinos, and crowds have already started to queue in many traffic point stations. It seems the volume of people using public transport is now back to normal. Commuter lines already snake around the Monumento station of the EDSA bus carousel. The queues already passed the footbridge and even reached up to the next street near the station. But the good news is, the lines are fast moving as there are many buses picking up the passengers and traveling along the highway. Many traffic enforcers already expected a sudden surge in the volume of people on the road. Under Proclamation number 1107, signed by President Rodrigo Duterte, November 2, or All Souls Day, was declared to be a working day even though it has traditionally been a non-working holiday. The same goes for December 24 and 31. This means people are expected to come to work today. The government said this move will help the economy recover from the adverse impact of the COVID-19 pandemic by encouraging productivity and minimizing work disruption. For work performed on a special working day, an employee is entitled only to the basic rate. No premium pay or rate is required since it is considered an ordinary working day. Charles, let me give you a brief traffic situation here in Commonwealth, Philcoa. Traffic enforcers say there is somehow an increase in terms of volume of vehicles, but as you can see, as of the moment, motorists are fast moving, and especially those who are towards the QC Memorial Circle. However, there are still some commuters waiting for their turn to ride their PUV. Charles.
Thanks for that report, Mon. That was Mon Gualvez reporting live from Commonwealth in Quezon City. 5 houses in Tondo caught fire on All Saints' Day after an Undas tradition went horribly wrong. Arian Calumbiran with the details.
It was literally as silent as the grave at the Manila North Cemetery on All Saints' Day. Only authorities from the MMDA and the PNP are allowed in the area to shoo away those attempting to enter the cemetery. As cemeteries remain closed for the Undas season, residents of Del Pan, Tondo turned to lighting their own candles in front of their homes and on sidewalks to remember the lives of their deceased loved ones.
Para po sa ating mahal sa buhay na nawala. Wala cemetery sa panahon ngayon dahil pandemic.
Kaya po nagtuturok na lang po kami ng kandila po para po makaiwas din po sa pandemya din po.
For Buboy Benedicto, lighting a candle during Undas is a family tradition.
Para po sa mga kamag-anak natin, para hindi na sa malalayong lugar, katulad ng magulang ko na sa malayo. Nagtitirik na lang kami.
The tradition, however, went wrong in Barangay 272. A resident lit up a candle inside their home and it was left unattended, causing a fire in the area yesterday afternoon. Because the houses are close together and are made up of light materials, the fire quickly spread, affecting at least 5 homes. No one was hurt from the incident, but it served as a warning for Del Pan residents to only light a candle for this Undas tradition outside their homes.
Sabi po yata, kandila daw po. Yung nagtirik po sila ng ano yata.
The blaze reached first alarm but was brought under control in half an hour. Authorities continue to investigate the incident. Arian Calumbiran, we are One News.
Experts are now calling on the government to distribute booster shots for health workers. Vaccine expert panel member Dr. Jean Solante said medical frontliners are once again becoming more vulnerable to COVID-19. That's as their 2-shot immunization begins to wane. And he said the current supply of COVID-19 vaccines in the country should be used as booster shots for health workers and the immunocompromised.
There are already surplus of the vaccine supplies, and I think that ilan lang ba ang mga healthcare workers, no? And these are the frontliners who are really taking care of COVID. Allotment of vaccine should also be prioritized for these healthcare workers, because as we move forward and we'll have some of this mini surge of cases, November, December, hopefully it will not happen. then we're always at risk for these exposures.
The OCTA research group says vaccine hesitancy remains a big challenge for the country's vaccine rollout. In an interview with the chiefs, OCTA's Guido David and Ranjit Rai cited results from their last survey, which showed that 22% of adult Filipinos said they wouldn't get COVID vaccines.
Well, based on the data that we have, 65% of of those who have decided not to have themselves vaccinated cite the reason of safety as their basic reason for not getting vaccinated. 14% say they have issues about the effectiveness of the vaccine. No, around 7%, and these are maybe the hardliners, no, who say that you don't need a vaccine. For COVID-19. And a disturbing 5%, although it's a small number, of those who have decided not to have themselves vaccinated are not having themselves vaccinated largely because may nabalitaan silang namatay dahil sa vaccines.
Racial diversity has taken a disproportionate toll on people of color, prompting experts to ensure diversity in clinical trials. Doctors tell us how they ensured racial representation in COVID-19 vaccine trials in this Bloomberg report.
When we first saw reports of the effects of the pandemic, it was disproportionately affecting communities of color. African Americans, Latinos, American Indians were being hospitalized at 3- to 4-fold higher rates, as well as deaths. And so it's clear that the impact was devastating, and that related in part to a higher rate of exposure. Many of these communities, individuals are employed in high exposure occupations, such as hospitality, transportation. So there's more exposure, more risk, and more devastating impact. And it was clear that eventually the best way to get out of this pandemic was going to be through new therapeutics and vaccines to be developed. And it was going to be important for us at NIH to ensure that the science that was going to lead to the development of those new therapies was going to get to those who were most disproportionately affected by the pandemic. So that's why we knew that outreach to these communities was going to be critical.
Eliseo, I mean, outreach to Latinos, Black, Asian Americans then was done. You managed to significantly improve the amount of people that were targeted within these trials and indeed make sure that there was not any bias built into the system. Eliseo, now, how are we ensuring that those people are also targeted when it comes to ensuring they're getting the boosters at the right sort of time? I see that Black doctors are being brought on to boost COVID vaccine rates, but are we doing enough?
Thank you, Caroline. The emphasis on the trials was really a full partnership with Moderna and the government at the time. So not to de-emphasize it, without Moderna being at the table and willing to alter their strategies, that we knew the strategies to follow, but they did follow our advice and they paused their recruitment in order to get to the right number. Then we saw that the communities of color had a lot of hesitancy about, is the vaccine too fast? Is there something strange about it? Can we trust the vaccine? And I think over the past year, we worked diligently setting up this community alliance against COVID-19 disparities that really emphasize full partnership with our community partners. We've set up now 21 teams across the country and Puerto Rico, and we have, I think, made a difference. We now see in the latest data that the rate of vaccination, at least for the first dose, between African Americans, Latinos, and white Americans is essentially the same. And so we're optimistic that we can get them to take the third dose and we'll get to full protection of the most vulnerable communities in the U.S.
The country's longest-running horror franchise is returning to give every Filipino a good scare. Regal Entertainment is bringing the Shake, Rattle, and Roll film series on YouTube for a limited time. Nick Garcia with the details.
Pinoy horror movie buffs are in for a treat. With the Opato Cats, they might shake, rattle, and roll. Regal Entertainment has been uploading full movies of the franchise on YouTube. Shake, Rattle, and Roll has 15 installments across 3 decades, beginning in 1984. It is the country's longest horror franchise, and the longest film series at that. One installment will premiere every day, from October 25 to November 8. In a post, the company also tells the public that it will bring back their most requested horror movies, from October 25 to November 2. What's left for viewers to do is to prepare to scream. Nick Garcia, We Are Win News.
Here's a quick look at some of today's headlines. LPG prices saw another hike for the 6th time since June, while gasoline prices are up for the 10th straight week. The country's outstanding debt climbs to a new high of 11.91 trillion pesos. But Ibon Foundation says the fresh set of borrowings didn't really go to pandemic response. And 1 in 4 Filipinos are now fully vaccinated against COVID-19. But experts warn against the waning immunity among fully vaccinated individuals after 6 months. And those are the top stories at this hour. Join us again later at 10:45 a.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We're One News.